Chronic stress is a persistent state of heightened stress response. It is a condition where the body remains in a constant state of tension and alertness, unable to return to a relaxed state. This ongoing stress response can be triggered by various factors and can last for weeks, months, or even years. It occurs when the body's natural fight or flight mechanism is activated for prolonged periods. This mechanism is designed to protect us in short bursts of danger, but when it is constantly engaged, it can wear down the body and mind. This constant state of alert can have detrimental effects on both physical and mental health. Physically, chronic stress can lead to issues such as high blood pressure, heart disease, and a weakened immune system. Mentally, it can contribute to anxiety, depression, and other mental health disorders. Unlike acute stress, which is short-lived and often triggered by specific events, chronic stress lingers and can stem from ongoing situations like work pressure or financial difficulties. These persistent stressors can make it difficult for individuals to find relief and can lead to a cycle of continuous stress. It's important to understand that not all stress is bad. Stress in small doses can be a motivating factor that helps us to perform better and meet deadlines. This type of stress is often referred to as eustress and can be beneficial in helping us to achieve our goals. In fact, short-term stress can be beneficial, providing the necessary boost to overcome challenges. It can enhance our focus, improve our performance, and help us to respond quickly in critical situations. This type of stress is usually temporary and subsides once the challenge is met. However, when stress becomes chronic, it can lead to a cascade of negative health consequences. Chronic stress can disrupt nearly every system in the body, leading to problems such as digestive issues, sleep disturbances, and even changes in brain structure and function. It is crucial to recognize the signs of chronic stress and take steps to manage it effectively to maintain overall health and well-being. Chronic stress manifests in various ways, affecting both our mental and physical well-being. Recognizing these symptoms is crucial for early intervention and preventing long-term health issues. Common psychological symptoms include irritability, anxiety, and difficulty concentrating. Physically, chronic stress can lead to headaches, muscle tension, and sleep disturbances like insomnia. It's important to note that these symptoms can also be indicative of other underlying medical conditions, so it's essential to consult with a healthcare professional for an accurate diagnosis.
The central nervous system, comprising the brain and spinal cord, plays a pivotal role in the body's stress response. It acts as the command center, processing information and coordinating actions. When we perceive a threat, real or imagined, the hypothalamus, a small region in the brain, sets off a chain reaction, activating the sympathetic nervous system. This tiny but mighty part of the brain is responsible for initiating the body's alarm system. This activation triggers the release of hormones like adrenaline and cortisol, preparing the body for fight or flight. Adrenaline increases heart rate, elevates blood pressure, and boosts energy supplies, while cortisol, the primary stress hormone, increases sugars in the bloodstream and enhances the brain's use of glucose. While these hormones are essential for survival in acute stress situations, their prolonged presence in chronic stress can have detrimental effects on various bodily functions. Chronic stress can lead to a host of health problems, including anxiety, depression, digestive issues, heart disease, sleep problems, weight gain, and memory and concentration impairment. The body's constant state of alert can wear down the immune system, making it more difficult to fend off illnesses. Understanding the impact of stress on the nervous system is crucial for developing strategies to manage stress and maintain overall health and well-being.
Chronic stress takes a significant toll on the cardiovascular system, increasing the risk of serious health problems like heart disease and stroke. When the body is under stress, it triggers a cascade of physiological responses that can have long-term effects on heart health. The constant surge of stress hormones, particularly adrenaline, causes a rise in heart rate and blood pressure. This is the body's natural response to a perceived threat, often referred to as the fight or flight response. While this response can be beneficial in short bursts, chronic stress means that the body is constantly in this heightened state, which can be harmful over time. Over time, this persistent strain on the cardiovascular system can damage blood vessels and arteries, making them more susceptible to plaque buildup. The inner lining of the blood vessels, known as the endothelium, can become damaged, leading to inflammation and the accumulation of fatty deposits. This buildup can lead to atherosclerosis, a condition that narrows and hardens the arteries, increasing the risk of heart attack and stroke. Atherosclerosis is a progressive disease that can start as early as childhood and worsen over time, especially in the presence of chronic stress. Managing stress through lifestyle changes, such as regular exercise, a healthy diet, and mindfulness practices, can help mitigate these risks and promote better cardiovascular health.
Section 5. Digestive Distress. The digestive system is particularly vulnerable to the effects of chronic stress. When the body is in a constant state of alert, blood flow is redirected away from the digestive tract to the muscles and other vital organs. This reduced blood flow can disrupt the digestive process, leading to a range of issues like indigestion, bloating, and constipation. Moreover, chronic stress can exacerbate existing digestive conditions like irritable bowel syndrome or IBS and peptic ulcers.
Section 6. Muscle tension and pain. Muscle tension is a common physical manifestation of chronic stress. When the body is under stress, muscles tense up in preparation for action. However, in chronic stress, this tension becomes persistent, leading to muscle stiffness, pain, and discomfort. Chronic muscle tension can affect various parts of the body, including the neck, shoulders, back, and jaw. This persistent tension can also contribute to headaches, particularly tension headaches, which are the most common type of headache.
Section 7. Reproductive health concerns. Chronic stress can significantly impact reproductive health in both men and women. In men, prolonged stress can lead to a decrease in testosterone levels, affecting libido, sperm production, and erectile function. For women, chronic stress can disrupt the menstrual cycle, causing irregular periods, more painful cramps, and heavier bleeding. It can also exacerbate premenstrual syndrome, or PMS symptoms, and contribute to fertility issues. Section 8. Immune system suppression. While short-term stress can actually boost the immune system, chronic stress has the opposite effect, suppressing the body's natural defenses and making us more susceptible to infections. Cortisol, the primary stress hormone, plays a complex role in immune function. In chronic stress, persistently elevated cortisol levels weaken the immune response, making it harder for the body to fight off invading pathogens. Section 9. The importance of stress management. Given the wide-ranging and detrimental effects of chronic stress on the body and mind, managing stress is crucial for maintaining overall health and well-being. Recognizing the signs of chronic stress is the first step towards effective management. Simple lifestyle modifications can make a significant difference. These include regular exercise, a balanced diet, adequate sleep, and stress-reducing techniques like meditation or deep breathing exercises. Section 10. Effective stress reduction strategies. Incorporating stress-reducing techniques into our daily routines can significantly mitigate the negative impacts of stress. Mindfulness meditation, for instance, has been shown to reduce anxiety and improve emotional regulation. Other effective strategies include deep breathing exercises, progressive muscle relaxation, and engaging in hobbies and activities that bring joy and relaxation. Remember, finding what works best for you is key to successful stress management. Section 11. Seeking professional help. If you're struggling to manage stress on your own, don't hesitate to seek professional help. A therapist or counselor can provide you with coping mechanisms and strategies tailored to your specific needs. They can also help you identify and address the underlying causes of your stress, providing support and guidance on your journey to better mental and physical well-being. Remember, seeking help is a sign of strength, not weakness.